mention a couple notes that, of course, as you can see, we are providing ASL interpretation, and we will also be having Spanish interpretation for the evening as well. And then you'll also see we welcome questions throughout the whole time, but we will have a section towards the end of today's session for actually answering those questions. But you can submit your questions at any time using the Q&A function that you'll see at the bottom of your screen. And then we'll make sure to try to get as many of those questions answered as possible. All right, let's go ahead and get started. We have a lot of people joining us today, both in terms of speakers and participants. Thank you so much for joining us on this very important and always timely topic, which is single-payer healthcare here in California. Before we get started, I want to mention again that we have ASL interpretation and Spanish interpretation for this evening. So shortly, we'll have Yesenia come on and give instructions for Spanish interpretation. But as is tradition for Courage California events, I do want to open tonight with an Indigenous land acknowledgement. Courage California acknowledges our presence on the traditional and unceded territory of hundreds of First Nations who are the traditional caretakers of this land we call California. As visitors on this land, we pay our respects to the ancestors, elders, relatives, and future generations. All right, and with that, I want to turn it over to Yesenia, who will provide instructions for accessing Spanish interpretation for this evening.
Thank you, Irene. Buenas tardes y gracias por estar aquí con nosotros, acompañándonos en este foro. Si usted necesita interpretación en español, por favor vea el icono que aparece en la parte inferior de su pantalla en forma de globo y oprímalo y seleccione español. Gracias.
Thank you, Yesenia. Thank you for providing a Spanish translation for this evening. Well, to get started, I do want to welcome you all, just to give you... Go ahead.
I apologize, Irene. I'm not in the room yet.
Oh, no worries.
Yes.
Get that sorted. For now, I just want to give folks a quick overview. Courage California is the largest progressive organization in the state of California. We have 1.4 million members around the state and around the nation. And we mobilize our members, many of you are our members, on different actions about lobbying and advocacy in our state capital and in Washington, D.C., trying to get more progressives elected to office, and of course, trying to hold corporations and our leaders accountable, especially on the issues that matter most. And of course, we know tonight, which is why we're hosting this event, that single-payer healthcare is really important to Courage members, but to all Californians. And we know in particular that this topic, single-payer, is a hot topic right now, especially with a bill that is moving through the state legislature that we'll speak about shortly. I do want to welcome our co-host for this evening. I want to welcome first Jody Reed from CARA.
Jody Reed.
The translation doesn't seem to be working. She should be in her own room with the people needing translation, and we're hearing her. Okay. Good now.
All right, thank you. Jody, if you want to introduce yourself and also talk a little bit about CARA.
Sure. Hi, everybody. My name is Jody Reed. I'm the Executive Director of the California Alliance for Retired Americans. We are a grassroots senior advocacy organization with representing about 1 million seniors through our over 300 affiliated organizations that come from labor unions and labor union retiree groups, community organizations, senior housing residents, mobile home residents, democratic clubs, and pretty much any group that wants to work on issues to improve the quality of life for seniors and our families and work towards a long life that is filled with dignity, independence, and grace. We have chapters around the state, and we work on a number of policy issues. One of the issues we've worked on since our inception, and that will be 20 this year, is working towards a single payer healthcare system. So we're very happy to be a part of tonight's event and look forward to working with you this evening and in the future to win guaranteed healthcare for everyone. Thanks.
Thank you, Jody. And I also want to invite Deborah Delmond from Healthcare for All California, as well as one of our co-hosts for this evening. Deborah?
Irene, thank you. I want to say Healthcare for All California has worked for almost 3 decades now to actively support single-payer healthcare in California. We're proud to be sponsoring this event this evening with the Courage campaign and with the California Alliance for Retired Americans. Healthcare should be a right for everyone, shouldn't be just the privileged. It's something that we've actively focused on for 3 decades, and we're in this to build a grassroots organization, to work through the legislature to get something enacted to support everyone on healthcare. Thanks, Irene.
Thank you, Deborah. All right, so as I mentioned, we've got a full packed schedule tonight. Single payer is complicated. As we saw, even just in the Q&A, just even the term for single payer gets really complicated. There's a lot of different aspects to it. There's a lot of need here in California. And so we have a wonderful group of speakers who are going to speak to different parts of it. So we have Ron Coleman from CPEN, the California Pan-Ethnic Health Network, who's going to speak about currently the state of healthcare in California and what we still need in order for everyone to access and healthcare here in the state. We're going to hear from Ana Alvarez from Health Access about the current movement to expand healthcare in California and sort of where some of that work stands right now. And then we're also going to hear from Tom Sinchich, the past president of Healthcare for All Oregon, as a sort of a model that California can follow. And then we're also going to hear from Michael Letty of the Healthy California Now Coalition about the specific single payer fight, especially the one in the state legislature, the president. And we're also going to hear from Cindy Young as well to talk about sort of the intersection of Medicare and single payer. And then, as I mentioned, we'll have a section for questions and answers. So please, at any time, if you have any questions, you could submit them using the Q&A button at the bottom of your Zoom screen. All right, so to kick us off, I want to bring on Ron from CPEN, again, to talk about the state of healthcare and what we still need to really achieve universal healthcare here in California. Ron?
Thank you, Irene, and good evening, all. My name is Ronald Coleman-Baeza, Managing Director of Policy at the California Pan-Ethnic Health Network. I'm based in Sacramento, originally known as Miwok Land, and thank you so much to all of you for the work that you're doing on this issue. Certainly, universal healthcare is important. Certainly, we believe that even with universal healthcare, there still will be things we need to do within the healthcare system and things that we can do today to really make sure we're delivering appropriate healthcare to Californians. And so CPEN brings together diverse racial and ethnic communities to advance policy that furthers health equity in order to reduce disparities and improve health outcomes in communities of color. For us, we really envision a healthcare system where all patients can achieve equitable healthcare outcomes and access the full spectrum of high-quality healthcare services, including integrated physical, oral, and behavioral healthcare services, but universally. As we all know, California has made significant gains in expanding access to care. We were actually really ahead of the curve back in 2007, before the ACA, when Governor Schwarzenegger and Speaker Nunez set out to spearhead reform at the state level. Particularly, many of us were really excited about the idea to significantly reduce the number of uninsured throughout the state. However, even with that plan, we knew a number of people would be left out. The politics were tough. Healthcare industry stakeholders definitely fractured those discussions. And there were also a lot of concerns just generally about the affordability for low-income individuals as well. And so fast forward to realizing where we've been with the significant gains with the Affordable Care Act. You know, certainly the Medi-Cal expansion alone has led to a significant decline in the state's number of uninsured, particularly for communities of color. You know, that state program does deliver services. Does it do it well? That's a question that I think we often should ask and should measure. But certainly there is room to grow even in the benefits that are provided through Medi-Cal. The state can definitely deliver them in a much better way to Medi-Cal beneficiaries. And so also outside of the Medi-Cal expansion, opening up marketplaces, particularly like Covered California, for individuals to purchase coverage at that time only with assistance, particularly from the federal government, also allowed more people to be pulled into the system. But even with these gains, I think as many of you know, so many Californians were left out. This particularly has been something that's impacted our undocumented community and mixed status families. There's also many others that have not been able to buy coverage in Covered California due to other high costs in California, whether it's food, housing, rent, or transportation. And one of my colleagues will speak to some of these issues as well. And then since the passage of the ACA, we've also had significant gains in covering undocumented people generally. Certainly we started with kids, we were able to cover young adults, we were able to cover seniors, and we're at the cusp of being able to provide coverage to all undocumented individuals starting in 2024. Additionally, since the ACA, there's also been some state affordability assistance in Covered California. That's covered premium assistance. Has there been room to do more? Yes. And so I think a lot of us are really excited about not only the gains for the undocumented in 2024, but also the opportunities to really have affordability subsidies that also help people pay cost sharing, whether that's deductibles or any costs they're facing at the point of service. There's still a gap to close, however, as we know, particularly for any undocumented people who may be over the Medi-Cal income eligible range. And so I think there is a question of where they go, how they will qualify, and what they do to make sure that they continue to get care. But certainly, I think my colleague will speak to that too, about some efforts underway to address those questions. Now, many of these gains should really be touted and celebrated, but it doesn't necessarily get us to the truly universal system that we think we need to have in place for all state residents to thrive. And again, really making sure we have integrated care, particularly around physical health, behavioral health, and oral health with quality delivery. And while there are gaps in healthcare system today, certainly, many of these gaps impact the uninsured the most, but, certainly people with insurance are facing many challenges in accessing certain services and care that really meets their needs. And so universal healthcare, as you all know, isn't necessarily just about everybody having access to care. Universal healthcare is about ensuring that everybody has access to care in the proper language so that they can communicate with their providers and so that there can be dialogue between providers and patients. It's about making sure that patients can fully understand the information that they're receiving about their healthcare in their spoken language. It's about making sure that a person has access to culturally sensitive or culturally competent information from their provider that really truly understands their background of who they are as a patient, to really be able to understand how to treat them the best. Good healthcare is also about having comprehensive healthcare services as it relates to behavioral health, right? And so making sure that that's both on the safety net side and any commercial healthcare system that may be in place in the interim, making sure that people have strong access to providers that meets their needs specifically on a language front, on a culturally sensitive front, are things that are going to be important. Additionally, having a universal healthcare system will also demand an ethnically and racially diverse workforce. Certainly having everybody in means that we need a workforce that represents community members to be able to meet all of those needs that I've described. And then also, certainly, as it relates to oral health, universal access to the full spectrum of oral health care, and really making sure that as part of universal healthcare, we're focused on health equity. And so I'll take a moment on that. Health equity is really about access to quality, affordable, culturally competent healthcare, regardless of your race, your ethnicity, your age, your ability, your sex, gender identity or expression, sexual orientation, immigration status, socioeconomic status, or your geographic location. And so getting equity right is important because it's about making sure that everybody can thrive. Health equity is eliminating racism's role in causing health inequities. It's ensuring that racism doesn't show up in the use of healthcare algorithms that are used in different settings, in how to allocate care and think about how care should be delivered. It's about ensuring that there's a pipeline for communities of color to access the jobs in healthcare. It's about working towards eliminating implicit biases that may impact provider and patient relations, and really reining in healthcare costs. You know, there's so many costs that are spent particularly on addressing disparities. And if we actually address the roots of disparities, which in many ways is often connected to racism, we really can successfully rein in some of those costs that are being wasted. And so it's really making sure that, you know, we deal with that connection that racism may have to health, whether it's physical, mental health, or a person's well-being. And so finally, I would say that it's also about making sure the communities themselves are actually in a better position to hold healthcare systems accountable for healthcare outcomes. And that's something that can happen locally at a municipal level or regional level to really hold healthcare system stakeholders accountable. Ultimately, I think for CPEN, you know, we really want to see a healthcare system that prioritizes people over profit, that prioritizes prevention over profit, is truly patient-friendly and community-centered. It really allows individuals to make well-informed and engaged decisions regarding their health or that of a loved one, and it really allows individuals access to information, data, and again, the governance roles to hold systems, plans, and providers accountable for providing quality and equitable care. And so that's, I think, what we think about when we think about getting to universality. And while, again, we've had a lot of gains in the state of California, we do think we have a long way to go to really master this as it relates to both quality and equity. Thank you.
Thank you so much, Ron. I really appreciate that because I think oftentimes when folks talk about healthcare, single payer, universal healthcare, people think automatically of coverage. But the centering of equity and comprehensive healthcare, culturally competent, high quality, that's a lot to pack into one. And so for me, this really illustrates really what's at stake with a high quality single payer system, that it's not just about coverage, it's about equity and centering communities. And that is the type of system that takes a lot of work to build, but also one to continue to develop and hold accountable as well. So I appreciate you bringing that really core concept, because again, I think oftentimes with single payer, we don't necessarily have those more nuanced, complicated conversations about what's really needed in our healthcare system. So, and with that, I want to bring on then Ana Alvarez from Health Access, who's going to pick up from there to speak a little bit more about the movement and the progress to expand healthcare here in the state of California currently, before we get to a single payer system. Ana?
Thank you, Irene. Can y'all see my slideshow? Yeah, okay, cool. Hi, everybody. My name is Ana Alvarez. I'm a campaign organizer with Health Access California. We're a statewide health consumer advocacy coalition, and we advocate on behalf of Californians who need quality, affordable healthcare, which is basically everybody who calls California home. And we are the co-sponsors of the Health for All campaign, along with our friends over at California Immigrant Policy Center. And let me see, how can I move my, there we go. So the Health for All campaign is a statewide campaign that has a goal of removing immigration status as a barrier to accessing healthcare here in California. And we do all of this work with a very broad coalition of over 100 organizations. We have some labor unions, healthcare advocates, immigrant rights advocates. We have clinics, direct service providers, medical students, doctors, so many folks that get involved in this coalition, and they support the work of the campaign in a range of different ways, whether that's lobby visits with their legislators, social media actions, sign-on letters, other letters of support, in-person events, story sharing, media engagement. It takes a village to be able to do this work, and we're super thankful for all of the work that our coalition partners have done so far. And I want to talk a little bit about the work that this campaign and coalition has done over the last 10 years, some of the wins that we've been able to achieve when it comes to the Medi-Cal space. Back in 2015, the coalition was really advocating to pass a Medi-Cal expansion for undocumented children ages 0 to 18. And thankfully that passed, and that went to an effect in 2016. We wanted to continue that progress, and so we shifted over to trying to get access for undocumented young adults ages 19 to 25. And the reason for that is because, you know, as you expand coverage to undocumented children, sooner or later they're going to turn 19 and 20 and 21, and we wanted to make sure that they had continuous coverage as they continue to, you know, grow older every year. And so we expanded access to coverage for young adults, and that went to effect in 2020. And then in 2020, the pandemic hit. It disproportionately affected older adults and seniors who were getting sicker from COVID-19. They were dying from COVID-19. And so the coalition really asked for us to pivot towards covering seniors because of that. And so in 2021, we advocated for that, won that, and it went into effect last May. And it's been really successful so far. The estimates that we had were about 285,000 older adults that we expected to be newly eligible for the program. And I want to say we got new data for that this past March, and the numbers look like about 347,000 that actually did enroll into Medi-Cal. So that's really great. People are actually enrolling into it and hopefully getting the coverage that the care that they need. And so as you see, with all of these expansions, we still had that huge age group of adults ages 26 to 49 who were undocumented and didn't have an option for coverage. And so we advocated for that last year. We secured it in the budget, and it had an implementation date of January 1st, 2024. So in a few short months, those folks will be newly eligible for Medi-Cal as long as they meet the income limit. And so we're really excited about that expansion. And I want to share some numbers with you all, just to show you the impact that the Health for All campaign has been able to make over the last 10 years. And so with the expansions that are currently in effect, which is Health for All Kids, Health for All Young Adults, and Health for All Older Adults, so far 634,000 undocumented Californians have so far enrolled into full scope Medi-Cal. And with this next expansion that's starting in January, we estimate about 700,000 undocumented Californians are going to be newly eligible. So over the course of, you know, Health for All, when it comes to Medi-Cal, the coalition in this campaign is going to be responsible for over 1 million folks getting coverage through Medi-Cal, which is really exciting. But even with all of that great work, we know that there's still people that are falling through the gaps who are not income eligible for Medi-Cal, but they still need an option for coverage. And we estimate that that population is about 520,000 Californians who are undocumented and who will remain uninsured. And so what are we doing about that? That's the next phase of Health for All, and that is removing barriers to Covered California. Covered California is a marketplace where folks with legal status can purchase coverage. They can get subsidies to be able to afford that coverage. And we want to make that same option available to those who are undocumented. And so we have a bill that we've been working on this year, and that is AB4, authored by Arambula. And this bill, we see it as taking the first step needed to removing immigration status as a barrier to enrolling into Covered California. And I want to share a little bit about the language of AB4 and what it does right now. So the language right now authorizes that Covered California creates a program where undocumented folks can purchase coverage, and it also makes sure that the plans that are offered in this program are as identical as the plans that are already offered in the exchange. It does note that subsidies may be provided in the future because we obviously want to make sure that this coverage that folks purchase is affordable. It also provides opportunities for stakeholder input. It says that Covered California would do the marketing and the outreach to let these folks know that they would be newly eligible for Covered California. And then it also protects the information of undocumented folks, which is really important. especially when there's this fear of, affecting folks' immigration status, public charge, and those kinds of things. We want to make sure that people know that this isn't going to affect you in any sort of way. So get the coverage that you need. And I wanted to talk a little bit about where this bill stands right now. Like I said, we've been working on it for the last couple of months, and unfortunately it was put on pause for this year. It became a 2-year bill, and it was parked in Senate appropriations. And for the next couple of months until we get to the next legislative year, we're going to be working on the policy with Covered California and with Arambula's office to make sure that it's in a really good place to pick up right where it left off. So we fully expect it to continue moving forward in 2024 around the springtime. So that is when I expect there to be a little bit more action on AB4 and the Covered California work. So just to let y'all know, I may be reaching out for some support on that end. But I did just want to let you all know about the efforts that we're doing to remove barriers to coverage here in California. I leave my contact info here. So in the case that, folks want to learn more about the campaign, want to get involved in the campaign and in the coalition, please don't hesitate to reach out. I'd love to get to know y'all and include you in that work. But yeah, thank you so much.
Thank you so much, Anna. I really appreciate it. Full disclosure, obviously, Courage California is part of the Health for All coalition, and we're proud to be so. So that's, to me, a really great illustration about both, as Ron was mentioning, we've made a lot of progress in the state towards getting people more access to healthcare, raising awareness that these are out there, but also our healthcare system, as we all know, is still kind of piecemeal. So it is still difficult to get people enrolled, to make sure they get access to healthcare, can afford it, and get the quality and cultural competent care that they need. Which is why single payer, of course, is the solution we keep ultimately returning back to. So before we get into details about how single payer is moving here in California, I do want to bring on Tom from Oregon, who can give sort of a little bit of a snapshot of how single payer has been moving in Oregon as both a partner and parallel to what is happening here in California. Tom?
Oh, well, thank you so much for this invite. Boy, there's a lot of work involved when we don't have a universal single payer healthcare system, isn't there? Day in and day out, all of these pieces. And we've done a lot of that work in Oregon, but I'm not going to, kind of go into that. So what I want to do is just do a real quick screen share here. And I think I can do it this way. Let me do this. There we go. First of all, it's a thank you for inviting me. Basically, I'm going to outline, and I got it here. I'm following it, and I'm going to make that all available to you. It's got a lot of links for you that you can get. And I'm going to be going over that, but I got just a little background to start with, which is, first of all, for myself, I'm a retired family nurse practitioner. And why do I do this work day in and day out? Why? Because I really got tired of spending 1/3 of my time dealing with insurance companies and pharmaceutical companies when all I wanted to do was take care of kids. Now, I happened to work in corrections health at one time where I didn't have to worry about whether they had insurance. I just provided the care. It was a great experience working there for 3 years in the Multnomah County Corrections Health facilities. So with that, I'm going to go to the next slide, which is here. I guess maybe I'll go to slideshow and start it. Maybe from current slide. Okay, there we go. Basically, 3 key ingredients I want to talk to you, give about a background to this. One is hope. Hope is such an important thing. I'm not a person that tolerates negativity very much in the terms of this movement because it interferes with the work we're doing. We've all heard a lot of quotations about what hope means, okay? But I've got one that I'm going to go ahead and give you. Hope is a passion for the possible, not some pipe dream wish. And we must have it at all times. When I was president of HCAO for 6 years, what I did was start every board meeting with this message, that we had to keep hope in the conversation all the time. Okay. The next one is going to go down here. Persistence. Even if it's just one person could do a lot. Just think, and we got a lot of work to do. That's why we have to persist. And it's not till we roll this ball all the way up the hill that we're going to feel better. But we got to persist. We can never give up. If we let go, that ball will come tumbling back down on top of us, and we don't want that. And the third item is, I'm going to go into this, which is strategic messaging or strategic planning. And we really need to have strategy at all times. And I'll get into the details of what the strategies are we're going to go forward with. So the question is, how is Oregon getting there? So now we're getting into our pathway. Okay. And I got a little slide. What you can see, it's not necessarily the road easily traveled. It could be any one of these roads. And we do not know what the road looks like exactly ahead. But if we go into this beautiful sunset, we will have a great vision going forward. Okay. So this is the path we've been following in Oregon. I'm hoping everybody can see this. Right. And if you see at the base of this, we're doing things like resolutions and stories and a ballot referral and gaining supporters. But if you look at the base of each one of these stairs, it talks about community engagement. Community engagement is a key element of every part and every step of the way. Without that, there will be no success. And I will be talking about that a little bit more later. I got too many things ringing in the background here. The next, so what we've done is I'm going to switch over here now into my outline. But you can see we have a pathway going forward, and this is what I'm going to be talking about in the next part of this. Okay. So, and there is a future. We'll be talking about a little bit about that as we go forward. And I'm here to throw down the gauntlet. Oregon is going to be first. Are we going to beat California to the finish line? Take a look at this. Somebody created this document for us. And for right now, this is where we believe that we're going to be out ahead on this thing. And I will going to go into some details. I'm going to stop sharing screen right now and get back to where I can see people. Okay. So first of all, this thing is a marathon. It was been mentioned how long California has been working on this. Well, Oregon is in its 23rd year of this work. And as you know, a marathon is 26.5 miles. Well, guess what? We think we're getting towards the end of this marathon. There's you'll see there's a report due at the end of 2026 to the legislature for the implementation of a universal health plan in Oregon. Will be based on a single payer system. So that is one kind of conceptually. But what you know for marathons, you never slow up. A marathon is not a slow pace. It's very fast paced. And you've got to, again, persist to the finish line. And as was mentioned earlier, that doesn't mean there's more work to be done. There'll be the next marathon to run once this thing gets passed. So I have an outline. And maybe I will bring that up if it's okay. I'm going to go ahead and share screen. Is this visible? Yes?
Yes.
Okay, great. Okay, so that was my first three elements. I talked about a marathon. Okay, so again, I will put a link to this document so people can get it and get access to these links, but these are also available at the hcao.org website. So don't want to go back before 2018, right? This is where the progress really started going. The 2018, the Universal Healthcare Access Work Group formed, but guess what? There were insurers at the table. They got in the way. There was not enough community engagement. These were things that, this is something that didn't really go where it needed to go. But the report can be found and they're on this link or at our website. Okay, so now things in 2019, learning lessons from looking at other states, right? I want to, did you not have the right legislature, the right governor, the right community engagement, right? There's a lot of elements that go into this. We felt, oh, we have a grand opportunity. Or were we reaching too far, too fast? In this case, Senate Bill 770 started out with a 87-page bill. That was the whole thing, right? Which had failed session after session. And we reduced that to a 12-page bill. But what we did was, as I point out above, we've kept these purposes, values, and principles. So I encourage everyone to look at those. They were mentioned in the previous conversation here. All of those things about cost shall be no barrier, equitable care, everybody in, nobody out. We have those built into our bills going, which makes it really different. Choice of providers. And I'm happy to answer questions about those. Comprehensive care, dental, vision, all of these things are built into the bill plan. Okay, lucky, as you know, in 2020, COVID hit. So in 2021, we added a special bill to give the 770 task force a extra time. They got an extra year, right? And we'll talk about their work down the line here. And in the meantime, in later 2021, the legislature gave us a referral to the ballot to put into our Constitution, access to healthcare is a fundamental right. Okay, great news, okay? And in 2022, in September, the task force submitted its final report. There was a lot of information, suggestions in that task force report. There was one recommendation: create the Universal Health Plan Governance Board. Okay, one clear recommendation with a lot of suggestions. And this is starting to come to fruition. After that report in September, ballot measure 111, which is now in our Oregon Constitution, Article 1, Section 47. It's the last item currently in the Oregon Constitution under Article 1. And it does exactly what it says above. Fundamental right to access to healthcare is now in our Oregon Constitution. And the links are going to be there if you want to read more details about that. So that brings us to the current setup, which is Senate in 2023, this past session, SB 1089 got passed, and it created the Universal Health Plan Governance Board. So what we've had, luckily, the legislature gave us 770, they extended it 428, they gave us SJR 12, a vote of the people to get access to healthcare as a fundamental right. The legislature gave us the ballot measure, and now the legislature has given us SB 1089. And these were all, except for the ballot measure, signed by the governor. So that was really, really exciting. So what are the next steps? This is where we're at. There's ongoing discussion as to where we are. The next step is to hire an executive director. What is the Universal Health Plan Governance Board? Basically, it resides now in the state in the Department of Consumer and Business Services. It's not external, right? It's an official part of the working body of the Department of Consumer and Business Services. And with staffing that's going to happen to go with this. And so that's going to be an important next step. We're looking at potential candidates for this executive director position. This was just passed at the end of June. So this takes a little bit to get this together. The governor's board appointments with the right kind of expertise are needed to be done. And then I put in this word of community engagement. So never forgetting community engagement at every step. There'll be community engagement in the appointment of these governance board, and there'll be community engagement after the governance board does its work. The governance board will have to do annual reporting to the legislature. And of course, in the future, we might need some legislative action and a possible voter referral. But the governance board is to bring basically an implementation plan for Oregon, and that will include the creation of a public corporation and a public trust where the money goes into this one place. What we did, again, one of the things what we've done is both for the task force and hopefully for this governance board, we've kept the insurers off the main table. It's not that we didn't listen, give them a chance to have a say, but we kept them out of the mix. We think that the lesson learned here is if they're sitting at the table, they will muck things up. So that's kind of where we're at. And with that, I will stop sharing because I want to answer a lot of questions.
Thank you, Tom. All right, if folks do have questions, feel free to submit your questions in the queue using the Q&A function at the bottom of your Zoom screen.
And let me also say that I will put the link now to that.
Great.
With all links. I'll go ahead and put that in the chat right now.
Thank you, Tom. So it seems like the summary is complicated. A lot of pieces have to be moving at the same time, but as you underscore, community engagement throughout every single step of the process is really critical. And I assume because it's going through the voters, the governor, the state legislature, that also means a lot of active involvement and engagement with those actors as well. Complicated, which is, I guess, what you would expect for something as significant as single payer. So with that, I want to bring on Michael Letty, the president of Healthy California Now Coalition. It's a coalition that Courage California is also proud to be a part of. And Michael's going to speak to where the single payer movement is here in California and the active bill that we have, also SB 770, moving through the state legislature, both what has brought us to this point and also sort of what next steps we have, including especially in the last 3 weeks of the state legislative session. Michael?
Thanks a lot, Irene, and thank you all for being here tonight. It's a real pleasure to see so many allies and to see folks who we've been working with, for many years. And, you know, there's a parallel track here that the track that Ronald Coleman described of essential substantive reforms to improve coverage and access and affordability. And at the same time, really since back in this current period, since 1994, an effort to create a comprehensive single payer program. And that was, you know, a high water mark was the effort to pass it on the ballot in 1994. It did not do particularly well, but a bill had passed the state Senate with a 2/3 vote that year. During the late 90s, a process similar to what Tom described in Oregon, Universal Healthcare Task Force in Oregon, there was a similar options project in California that ultimately led to a series of bills authored by Sheila Kuehl when she was in the legislature. And those bills in the aughts, as we say, made it in a couple of cases to Governor Schwarzenegger's desk, only to be vetoed. And then that effort continued into the sessions in the 2010s with a couple of hiatuses. Then an effort when Jerry Brown was governor was initiated to pass SB 562. It too passed the state Senate, but was stalled in the Assembly. There was a break, and then last session, AB 1400 was introduced, authored by Assemblyman Ash Kalra, which passed the Assembly Health Committee, but was pulled before a floor vote in the Assembly was taken, so it stalled there. And that has a very similar history to Oregon, the series of attempts to pass comprehensive reform, but a recognition that so far the legislature hasn't been willing, hasn't had the political will to pass it. And so many of us looking at this year's legislation decided, well, let's build on the work of the Healthy California for All Commission, which is again similar to the task force that was conducted in Oregon. They found that the current system of fragmented care with huge amounts of administrative waste, with profit making in key segments of it, with people experiencing financial barriers to care, huge problems in equity, huge discrepancies between types of coverage, huge waste of money, estimated that just with the current system as it is, with those gaps in coverage that we've heard about, will cost an extra $500 billion over the next 10 years. And that, more important, 4,000 lives will be lost just because of the healthcare system. Tremendous community outreach was done, identifying particularly the needs for culturally competent care, again, as Ronald Coleman laid out. And so taking this commission and the momentum that it created, very powerful statement for guaranteed healthcare for all, we decided, well, let's follow up on that commission, address the unresolved issues, and in particular, set up a transparent, accountable process on a concrete timeline to engage with the Newsom administration as it initiates informal discussions with the federal government over their potential support, financial and policy support for a program of what the commission called unified financing in California. And that's the origin of SB 770. Now, what is the case with SB 770 is both a political and a policy initiative, huge levels of support. I want to mention California Pan-Ethnic Health Network that Ronald represents, Health Access that Anna represents, CARA that Jody is here from, Healthcare for All, Courage Campaign, all these coalitions, along with a significant group of unions, including National Union of Healthcare Workers, SEIU, Unite Here, Machinists, Teamsters, California Federation of Teachers. It's quite extraordinary, the coalition we built. The California Academy of Family Physicians, devoted to primary care, is a key supporter, along with historic single-payer organizations, Physicians for National Health Program, as I mentioned as well, Healthcare for All. So this effort for SB 770 essentially seeks to assist and guide those discussions that the Newsom administration is going to have with the federal government. That is actually how every kind of waiver process under the Affordable Care Act and under the current federal laws governing waivers is done. They first figure out, okay, what are you likely to approve before we ask the legislature to adopt a program? And it's quite significant as well that there are specific provisions in SB 770 that speak to the kind of issues we've been discussing tonight. And so what happens is a work group is formed, similar to the governing council that Tom discussed from Oregon. And in fact, the composition of the work groups is very similar to the governing council that they implemented through SB 1089. So we've been very aware of what Oregon's doing and been on a very similar parallel track with them. And so what the SB 770 does and describes as a universal healthcare program, comprehensive package of medical, behavioral health, pharmaceutical, dental, and vision benefits, long-term care, support, and services. Guaranteed services will not vary by age, employment status, disability status, income, immigration status, or other characteristics. The elimination of the distinctions currently existing between disparate systems of Medicare, Medi-Cal, employer-sponsored insurance, and individual market coverage. Specifically, the elimination of the adverse impacts of insurers attempting to avoid covering the sick or the benefits patient need in favor of a system that is proactive, mission-driven, focused on keeping Californians well. That there will be a detailed program to ensure a just transition for insurance personnel or other individuals whose jobs are disrupted by the creation of a single-payer system. Assurances that there'll be no copays, that it will, in fact, be cost-effective, that greater freedom for patients to choose providers, incentives to investments rather in public health. One of the key objectives under SB 770 is the promotion of a workforce that is diverse and able to provide culturally and linguistically competent care to all Californians, regardless of race, nationality, ethnicity, sexual identity, and socioeconomic status. And finally, something that has been an issue, SB 770 specifically calls for the prohibition on the kinds of risk-bearing contractual arrangements that could incentivize providers to withhold needed care. So what we're seeking to do is to take these movements that have achieved so much in terms of improving coverage, access, and affordability, create and combining that with the recommendations from the Healthy California for All Commission, creating a broad stakeholder process that will engage with the federal government and inform the legislature on what kind of program is best suited to meet all of these objectives. And that really is a culmination of all that we've learned in this struggle for universal health care in California. But the bottom line is it's guaranteed health care that provides better care at lower cost. And it does so by bringing folks together in a collaborative, accountable process on a concrete timeline and answering all the questions that the legislature has posed, and specifically addressing the role of the federal government financially, in particular, in establishing a guaranteed healthcare system in California. So it's really, hopefully, we're moving forward. We got a 30-9 vote in the state Senate. We got a 10-4 vote in the Assembly Health Committee. We're currently in the Appropriations Committee of the Assembly on suspense, waiting to see if we can reach an agreement with the Newsom administration to get the bill off suspense and onto the Assembly floor where we're optimistic about its chances. And it's really been an extraordinary effort. I think you can see the different elements we've learned from the work of the Health for All campaign. We've learned from the issues that CPEN has raised, particularly in its most recent report on equity in healthcare in California. We've taken the lessons that CARA has given us around the experience of folks on Medicare. We've taken the momentum and the support of single payer activists like in Healthcare for All California, and the political efforts and coalition building of Courage campaign to bring these together in a movement that can win once and for all the kind of universal guaranteed healthcare system that all Californians need. So thanks a lot.
Thank you, Michael. So again, trying to mirror again what's happening in Oregon, putting a lot of these pieces together on the same track and making sure that people are talking to each other. Certainly, when I talk to people about single payer, people are usually supportive of it, but have questions, have a lot of fear about implementing such a significant system. And so again, just want to emphasize how important it is to have this community engagement and engagement with leaders along this whole pathway. All right, we do have one final speaker before we get to some of the questions that I see in the Q&A. Just a reminder, folks, if you do have any questions, please put them in the Q&A function at the bottom of your Zoom screen. Cindy, we're welcoming Cindy from CARA to speak specifically about Medicare and single payer.
Well, thank you. And thanks everybody for getting on tonight. My name is Cindy Young, and I serve as a vice president for Unite here on the California Alliance for Retired Americans Board of Directors. And it's an honor to be with you all tonight. So I'm here tonight just to talk about, the Medicare piece connected to single payer. And if you go back and look historically, Medicare and Medicaid was signed into law in 1965, providing social insurance to the elderly, that Medicare, and poor Americans, Medicaid. Traditional Medicare and Medicaid, and just to reframe this in California, our Medicaid program is called Medi-Cal. It allowed those participating in these programs to go to any provider that accepted either Medicare or Medicaid. Because of the out-of-pocket expenses of Medicare, the private insurance industry developed Medigap plans that cover some or all of the out-of-pocket costs for seniors on Medicare. So there's a deductible in Part A and some out-of-pocket expenses over and above the premium that seniors pay for Part B coverage. In the Balanced Budget Act of 1997, it established a new Medicare Part C called Medicare Advantage or Medicare Choice. To enroll in Medicare Advantage and to a Medicare Advantage plan, you have to assign your Medicare Part A and your Medicare Part B benefits over to an HMO. At the time that the Balanced Budget Act was passed, the private insurance industry, of course, promised our politicians and seniors that they would give them some limited additional benefits to Medicare, like a limited dental or vision plan. And then, of course, they promised cost savings in the Medicare program to politicians. And as you can guess, the insurance industry heavily marketed these plans. They had a strategic move on this. They knew this would line their pockets with millions of dollars. So they heavily marketed these plans with free breakfast and snacks at local restaurants and enrolled millions of seniors into a Medicare Part C or a Medicare HMO. And, if you were to look on the Medicare website now, you would see they're actually recruiting seniors into these plans as well. So that really blossomed this whole private insurance market into our Medicare plans. And to make matters worse, the Trump administration doubled down on privatizing Medicare through direct contracting, through a direct contracting pilot, and it's been rebranded under the Biden administration as ACO REACH, which allows private equity firms and Wall Street companies to take up to 25% or more of every Medicare dollar for administration and profits for managing Medicare claims. This also restricts seniors' choice once they get inside one of these ACO REACH plans. If you live in a rural area, it's limited network, and we have some seniors who have to drive from like Eureka down to San Francisco to get care now because they were pushed into one of these plans. So CARA has a joint resolution. It's called Joint Resolution 4, which jointly calls on the houses of the California legislature to request President Biden to terminate the ACO REACH pilot program, which undermines the core consumer-directed principles and allow seniors to go back into traditional Medicare. So that's our joint resolution. It should be up on the Senate floor next week. We may be calling on all of you to help us get that passed. So for seniors trying this back to single payer, the only way we're going to stop the privatization of the Medicare program is to get back to this whole social insurance traditional model of Medicare. And by having single payer, we stop the privatization of the Medicare program and the Medicaid program. Both of those programs in California, particularly the Medicaid program, has been turned over to Medicare HMOs. So from our perspective, getting single payer makes Medicare financially viable. It allows total freedom of choice to go to providers, no more networks, and it covers all of those out-of-pocket costs. There are so many things that seniors have to pay for under Medicare now. We're paying for glasses, for dental coverage, for hearing aids, for prosthetics. I could go on, long-term care, right? All of those things. So this is why seniors support single payer, and why CARA is really behind single payer, so that we can provide those benefits, freedom of choice, and financial solvency on the Medicare program to seniors either in our state or nationally.
Thank you, Cindy. And thank you. You also ended up answering one of the questions that was in the Q&A about privatization, of course, trying to keep private insurance companies out of the single payer system. Michael, I want to also bring you back on to answer a key question that I see here from folks too, of how does SB 770 in this bill interact with CalCare?
Well, we approached the California Nurses Association before we introduced SB 770, hoping to, work together. Those discussions ended up not occurring. We also approached Assemblymember Ash Kalra before we introduced the bill, asking him to sponsor it, that is to author it. And at that point, he had a whole draft of the bill and so forth. At that point, he declined, saying, he wanted to focus on CalCare. So we have from the very beginning sought to collaborate with CalCare. Since CalCare is a spot bill, in other words, it's not moving this year of the legislative session and will be given content next year in January to move then, we felt the urgency to do something now to build on the momentum of the Healthy California for All Commission report. So we initiated 770, and we did something that is actually ambitious, and that is put in a timeline so that the final report that the work group required by 770 that I mentioned would be done by June 1, 2024. So if CalCare is able to move through the first house, any recommendations from this report process could be incorporated into it as it moves into the second house. Also, the work group provides a vehicle for those policies and principles and approaches of CalCare to be incorporated and presented to the work group process so that that can be recommended, that can be part of the recommendations that the work group makes to the legislature. So if you can convince the work group of these policies, all the more likely that the legislature would adopt them. So that's why we had felt that these were complementary approaches, particularly because we're focused on moving the bill this year. And many of the organizations in the Healthy California Now coalition supported, including the coalition itself, AB 1400, and many of these organizations anticipate supporting AB 1690, next year's version of CalCare. So from our point of view, there has been no irreconcilable differences, no need for a division. And so we continue to kind of take the high road and try to move forward positively for SB 770. As you can see from what's going on in Oregon, this is not a unique approach among single payer supporters. And so we think there's great value in both.
Thank you, Michael. And I want to emphasize too, Courage has also supported all the single payer bills that have come before the state legislature. And for us, I also want to emphasize as well, it's really key. This SB 770 bill moving through the state legislature means that there are votes on record. There are legislators who we know will support it and those who won't. And these are the votes and the legislators that we can leverage for support of the full single payer system. So I want to emphasize that as well. I think that's really key. Go ahead, Michael.
So I just want to add, Irene, if I could, that there are co-sponsors of both bills. Kevin McCarty is a co-sponsor of both bills. Miguel Santiago is a co-author of both bills. So from the legislators' point of view, they see these two bills as compatible.
Thank you, Michael. I do want to shout out Ingrid and Tim who are providing ASL interpretation and Yesenia for providing Spanish interpretation. Just wanted to note that you guys got a shout out in the Q&A as well for the work that you're doing tonight. So I realize that we're a little bit after 6 o'clock. I do want to bring back Ron for a quick question as well, because I think starting with this understanding of sort of where are the gaps, what are the needs, and what more we still need to do with this healthcare system. CPAN has done a lot of research about these sort of gaps, but also sort of gauging people's interest and desire for single payer. So I was wondering if you could speak really quickly about some of your research and sort of what are you hearing from different communities about single payer and what they really want to see in a healthcare system here in California?
Thanks so much for the question, Irene. I think for us, as you all know, CPAN definitely works with a lot of different diverse racial and ethnic communities. We work to bring those communities together, think through differences, and really come up with common solutions. I think typically, we hear the same thing that resonates from many different communities, regardless of background. And it's really making sure that they get the type of care that's culturally sensitive in their language, and that truly meets their needs. I think a lot of patients in communities of color deal with racism and or perceive that their providers are not listening to them, don't want to necessarily work with them, don't necessarily understand where they're really coming from. And so I think making sure that we have mechanisms in place to make sure that we can use interpreters where we need interpreters, actually have providers in place that represent various communities, working with CHWs in different communities to really get the word out, I think is important. And again, really making sure that that's not something that we think about just as it relates to a person's physical health, but also making sure that the language access, the cultural sensitivity is there, particularly as it relates to behavioral health, where it's really important, and making sure that people can fully thrive and be well.
Thank you, Ronald. All right, so I'm sorry that we're not able to cover everyone's questions in the Q&A. We'll provide some more follow-up information and links after tonight's town hall. I do want to turn it over to Michael just really quickly to re-emphasize a sort of call to action about SB 770, again, active in the legislature. And what can people do now to make sure that we keep moving on single payer here in California?
Well, we can, folks can call as representatives of your organization to the Assembly Appropriations Chair, Chris Holden, who is going to be, kind of one of the key deciders as to whether the bill moves forward. And also, most importantly, call your member of the Assembly, because we're expecting this to be in a floor vote sometime between September 1st and September 14th at the end of the session. So the members of the Assembly need to hear from you in your support of SB 770. And I think it's also go to the healthyca.org website. The SB 770 page has complete information, the bill text, fact sheets, how to contact legislators, complete action center there at healthyca.org. And you'll be able to be fully informed about the bill. Also, can put in the chat an email address for the organizer for Healthy California, Carolyn Bowden, and she can be reached at carolyn@healthyca.org. And that email is now in the chat, and she can address any follow-up questions, help you put in a support letter for SB 770, and otherwise engage you in the campaign. So I see
Yes,
out of
yes,
set.
Lindsay just shared it.
Yeah.
Yes. Thank you, Michael. And I also want to underscore something else too on the Healthy California Now Coalition website. There's also a health savings calculator. So if folks just want to see very directly what a single payer healthcare system would save in terms of your annual payments in terms of healthcare, the calculator is right there. So again, call your Assembly member. This is the time. We just have 3 more weeks to go to try to move this bill through the state legislature, and hopefully very soon after that to the governor's desk as well. And then, of course, after the state legislature is done, of course, any advocacy towards Governor Newsom to get this signed into law would be helpful as well. So with that, I want to thank you all for joining us tonight, unpacking a very big, complex thing such as single payer, but very needed here in California. As you heard from Ron and you heard from Anna, there's also a lot of other work that needs to happen to ensure that the healthcare system that we have right now better serves the people of California. So I encourage you to all join the Health for All campaign and coalition as well. There's also plenty of other active bills out there, some that would end surprise billing for ambulances, extend different benefits. So a lot of work happening all around California to really make sure that we have at least inch towards more universal healthcare until we get an actual single payer healthcare system here in California. So I urge you all to call your Assembly members. There's multiple places to look up who your representative is, but it's really important. I've been spending a lot of time in Sacramento this year, and especially in the next week, this week, last week, and I hear very directly from legislators. They hear all the talking points from industry, from special interests, from groups, from coalitions, but what really, really helps them make their decision, what really makes an impact for them, is to hear stories directly from constituents in their district. So I can't emphasize how important it is for you to call your Assembly member, share your healthcare stories, share about the burdensome costs, share about the difficulty in access, and how single payer and SB 770 will make this better here in California for you. Appreciate you again for showing up tonight on this really important issue. Thank you for your support, and a proactive thank you for calling your Assembly member and helping us pass SB 770 this year. Thank you so much tonight. Have a good night. Be well, be safe, and be healthy. Thank you.